We are live. Good afternoon and welcome everyone. This is our first symposium of 2023 in collaboration with GSK entitled New Healthy Habits for the New Year. My name is Kelly Casas Rosetta and I am a 30 plus systemic lupus patient. And I am the creator and executive director of the Portland-based nonprofit More Than Lupus. And if you are unfamiliar with More Than Lupus, we are a patient-centered, inclusive place for lupus patients of all ages, of all stages, and of all backgrounds that provides a space to connect with community, to find patient resources, support, and advocacy information. You know, at More Than Lupus, we're always constantly trying to share ways where we, as lupus and autoimmune patients, can become more active participants in our health journey. Because often with lupus and many lupus overlap conditions, we can feel like we don't have much control over what happens to us in our bodies. So today, we are going to talk about how we can have and gain more autonomy by incorporating simple and effective methods that we can hopefully commit to in the new year. So let's be clear, we are not talking about gimmicks here. We are talking about becoming mindful of the things that we are doing that may be hindering our health and initiating strategies that could possibly help our health in the new year. So I am thrilled to be your moderator today for today's discussion, and I'm even more thrilled to be joined by these two esteemed professionals, Tatiana Speigler, who is an RN and patient engagement liaison for GSK, and Melissa Talwar, board certified functional medicine health coach and creator and executive director of the Support Fibro Network. Before I turn it over to our guests to introduce themselves, I wanted to give a brief disclaimer for today's discussion and remind all of you out there to share this if you have an opportunity to do so. Please understand that the opinions shared today are purely for informational purposes and do not replace the medical advice and/or opinions of your doctors or healthcare providers. Today's event features qualified professionals whose comments are based on years of education and training. However, they are not liable for their comments since they are not acting as your personal physician and do not know the nuances of your medical history. Lastly, if you are experiencing lupus or lupus overlap symptoms, it is important to follow up with your doctor to seek the treatment that is best for you. So let's welcome our first guest, Melissa. Good afternoon, Melissa.
Hi, Kelly. I'm so excited to be here. Thank you for the invitation.
Always a pleasure to work with you. Many of you might recognize Melissa from some of our former symposiums and things I've done with her on her platform as well. So Melissa, why don't you go back to the beginning and tell us a little bit about yourself and your background?
Well, first and foremost, I mean, we've collaborated together at More Than Lupus and Support Fibro, so I'm excited to do more collaboration this year. I am a fibromyalgia patient. I became a fibromyalgia patient as a teenager, managing chronic pain, fatigue, brain fog, all of the above, right? Stomach issues, all that comes with it. I do have underlying autoimmune conditions that have yet to be given a name. So that's why I'm excited to present. I became a health coach. So I'm a board certified functional medicine health coach, trained in functional nutrition and neuroscience as well, and have done additional certifications with Dr. Terry Walls and Dr. Dale Bredesen. So that brings me here. But I just want to remind people too, I'm just a patient like you. So the goals that I talk about and the things that I talk about in the presentation are things that I currently work on as well.
Mm-hmm. Well, wonderful, Melissa. Well, I'm going to hand it over to you for the next few minutes for your presentation. Also remind everyone who is watching this live, go ahead if you have any comments, any questions for Melissa during this time, please post them in the comment box, and we will do our best at the end of her presentation to go through one by one. Obviously, if she's able to answer the questions and it's appropriate for her to answer. So take it away, Melissa.
Well, we're going to have some fun. I'm going to create a lot of awareness. I'm going to ask a lot of rhetorical questions in this presentation because I want everyone to just start diving in and get creative. The big thing for these healthy habits for the new year is I want people to create more joy in their life. I want you to throw away some of the perfection, the shame and guilt that might come with setting goals for the new year. And we're going to just dive in. And really, as a health coach, what I do a lot of the times, besides setting goals, is creating more awareness. And everything here is individualized as we go through these pillars of health together. Remember, it's not one size fits all. So again, I mentioned I'm a fibromyalgia patient. So a lot of these things with movement and all this, it's very different and individualized for each person. So please remember that. And then a lot of these concepts too, we want to improve your immune function, your immune tolerance, and then also consider lowering inflammation. So these are the underlying goals as we set these healthy habits for a new year. As I mentioned, I am a national and board certified health coach and trained in a lot of functional medicine. I'm also the executive director of the Support Fibro Network, so a lot more collaboration happening with More Than Lupus. I wanted to start this presentation with talking about SMART goals. You can't set a goal if you don't break it down a little bit. And sometimes as we start the new year, it gets really complicated because we're like, I'm ready to go in, all in. So we're talking maybe about, I'm going to go exercise all the time. And there's that E word. We're going to do this. I'm going to go to the gym, all in. I'm going to lose weight. I'm going to eat healthier. But in these sense, it's a really top level goal. And this is kind of what happens with many of us. We might fizzle out, or we might be doing this juice cleanse that someone suggested. And then you're like, oh my gosh, I wasn't able to accomplish this. So as we're heading into the end of January, you're reevaluating things. And what we want to steer away from is the idea of failure. And again, throw away failure, throw away shame and guilt. So what's happening with these goals is they were really, really top level. And what we like to do in health coaching is break things down to be SMART goals. So very specific. So for example, if you are interested in, eating healthier this year, what does that look like for you? And again, really think about what that looks like for you. It's individualized. How can you attain these goals? What does it mean to eat healthier? Like, why are you doing it? Do you want to lower flares? Do you want to be in less pain? Is that why you feel that you should be eating healthier? And then this is the part where we break it down. So be really specific with what that means. So maybe it means adding in a cup of leafy greens at lunch 3 times a week, right? That's really, really specific. Maybe then you're doing it measurable too. So you set aside 2 weeks. So for 2 weeks, I am going to eat a cup of leafy greens at lunch 3 times a week. So we got really specific. So we break it down with these SMART goals all throughout your set, like whatever goals you're setting. And then you start reflecting on, does this feel attainable? And this is what I ask people all the time. So what I just said, can you actually manage adding in 1 cup of veggies 3 times a week? Does it feel relevant to your overall goal of adding in more nutrition? Does it feel attainable to you? We've set it time-based. So over 2 weeks, you're going to look and you're going to reevaluate, how did this feel? Were you able to accomplish the goal? Now, again, we throw away failure. And if things didn't work out, there might have been something that we call barriers getting in the way of you setting goals. And creating awareness about barriers, resources that you need, maybe you needed extra support, all comes into the SMART goal setting. Because maybe you had to go buy leafy greens in order to add it in, or adding more veggies. What does that look like? Maybe you have to learn to cook. Maybe you need some more recipes. Maybe you need someone else to go shopping for you. These are all things that might have gotten in the way of you accomplishing your goals. So that's why we really talk about SMART goals and emphasizing it and creating awareness when it comes to goal setting. It's foundation for setting the goals for the new year. And that's why I wanted to just make sure to bring it up. Please ask questions. And if anyone has set SMART goals before, I would love to see it in the comments and see if you've already started these goals and maybe how we can help you after the end of the presentations, break this down to be more familiar, more attainable for each of you as well. So let's have fun, get creative, post in your comments because we have some great presentations ahead. Now I'm going to start out with movement. I don't like using the E word. Remember, I'm a fibromyalgia patient. There's a lot in that when you say the E word. So what I love to remind people of when we're talking about moving and moving our bodies is to remember to play. There's no rules, right? We forgot how to be kids. Remember the days we were playing hopscotch, hula hoop, going out there, we're having fun in the playground. Some of us, you're playing with the balls, stuff like that. Please consider play as far as movement goes. If you have a family, it's okay to act silly, dance in the living room. Find joy in the movement, because a lot of the times we tend to do stuff like maybe you're going to walk on the treadmill every single day, but you really don't like walking on the treadmill and it's just taxing. So that's where we always remind people, please find some joy in what you're doing. And this helps you actually fulfill your goals. Then again, mix it up, walk in nature, go gardening. It doesn't have to be the same thing over again, because sometimes, again, these rules, these 10,000 steps, what does 10,000 steps even look like? Can you mix it up? You actually start to walk more and do more things when you're having a lot of joy in what you're doing. So stretch, dance, throw on some music if you're cleaning the house. Have fun with laundry. If anybody likes squats or anything like that, lift that basket and really get into it. And like pretend you're on like a stage and you're winning an award for the best laundry. Like lift it up. Like have some fun with your family and yourself. Like it's okay. We can do this. There's no rules. Tai Chi, aquatic therapy, chair yoga. The movement is endless and there's a lot of resources online if you need this information. So don't forget that part. Focus on what you can do. This is huge for anyone that lives in a push-crash cycle right now. So I want you to reel yourself back. If you're doing suddenly, you have to do those 10,000 steps, but then the next few days you crash out and you can't do any more, and you're going in this push, push, crash, crash, push, push cycle. I want to just create more awareness for you to see if you can break this down a little bit more. And I know when I work with clients, they're like, this is too easy. But what I like them to do is maybe start out with 5-minute movements a day. They're like, that's too easy. I'm like, okay, well, for 2 weeks, let's see you do 5 minutes of movement every single day. Then you can come back to the session. We'll talk about it and how it feels. And if it's easy, we can bump it up. You can always start slow and build up from there. But you're trying to move your body daily. We know the importance of movement, but we want to stay clear of this pain, inflammation, this crash cycle as we go through. So as we create more awareness in this presentation, this is what it's all going to be about. I'm not going to necessarily tell you what to do, but I want to just get the brain flowing and your imagination going, and of course, have more fun. Sleep is the foundation of all of this. So there's so much to go into with sleep that I almost didn't even know. It should be a presentation in itself. But top level highlight things for this is creating a peaceful bedroom for yourself, finding comfortable bed, pillows, creating a temperature that works for you. This should be your haven. And you can set boundaries for yourself to avoid distractions, make time for sleep. Take the time to get the actual sleep you need, which again may require setting boundaries, telling people, nope, I'm done. I've turned off my phone. I'm going to take care of myself. Maybe give yourself a massage. Use what you need if you like essential oils. Really set this up so that actually you're taking the time to be ready for sleep. And I know that's routines. Sometimes people find that helpful, and you stop what you're doing and really do what you need for goals to get good quality sleep. You might need to limit stimulants. You might not be able to eat as late. So this is where we're going to create awareness and better sleep hygiene habits. If you have some struggle with insomnia, there's some mindfulness tools that we can share with you as well. So anything that where you can get good quality, deep, restful sleep. So if people are struggling with that and this becomes a goal, there's a lot of strategies that you can do to create better environments for sleep as you move forward. And there's so many tricks too, especially if you need white noise machine, any of that, dark rooms, amber lights, amber glasses. Another big topic with getting good quality sleep is natural light and devices. And I could go into this forever. Avoiding devices right before bed, or if you're lying in bed, you're holding the cell phone as you need to go to sleep. There's a lot of great science about this now. And getting some natural light first thing in the morning. And I know for lupus, we've got to watch going outside getting too much sun. So this doesn't revolve around being out there like bathing in the sun. So what we're talking about is exposing your eyes to natural light first thing in the morning, not your cell phone light, natural light coming from outside. And there's really good science on this. If you follow someone like Dr. Andrew Huberman, he has long podcasts that go into a lot of the details of this. Now, I didn't realize this when I was younger, when doctors told me you got to go outside, go for a walk early in the morning. Now I get it. You can put it on your own schedule, even if it means just opening a window and getting some natural light, forming a routine before you jump on your cell phone. Save that for a certain time, but let yourself take care of yourself before you do those things is super important. And I did include some science here for the slide deck. I love this actual image from the biology dictionary because this is what it was referring to. So melatonin, a big thing that we talk about, starts to build up, but it needs to not have the light. So activation occurs when the eye stops receiving signals of bright light. So when your body produces melatonin in response to light hitting the retina of your eyes, so if you have your cell phone right in front of your face, you're telling your body, please don't produce melatonin. So this is this whole system together. So there is science to this in the brain. So you don't want to do that to your brain and tell your brain to stop producing melatonin because you need melatonin. You need it to help produce those signals to help you sleep better. So this is just some of the detailed science. If anyone wants to nerd out a little bit, I can share more articles with you so that we can do that. And there's a lot of science too of like going and watching the sunset. So that kind of starts to reset everything. And then you can dim lights as sunset occurs a little bit more. A lot of detailed science on this moving forward. Nutrition is another pillar of health that comes up quite a bit with health goals. Now, we want to make it simple for everyone because, again, we go all in. Maybe it's individualized for each person. You got to figure out and create awareness what works best for you. And it's important to distinguish this. So some of the top level things for lowering inflammation and setting the health goals that I talk about for nutrition is have fun with colors. I know we say eat the rainbow, and I'm not talking about Skittles. Add color, have a colorful plate, add whole foods of vegetables and fruits. And this whole process, I'm going to remind people, it's not about starving yourself or stress, because you'll actually create more stress in your body if you're nutrient deficient, and you won't be able to build up better immune function if you're starving your body, you're not giving yourself nutrient dense foods. It really creates havoc in the immune system. And then if you're also stressed around nutrition all the time, that doesn't help either. It affects your digestion, it affects your skin. You might get headaches and really associate things with bad habits of eating nutrition. So we have to try to create more awareness and make it colorful and fun. I encourage people to always explore colorful vegetables. I love purple. So find purple vegetables, purple cabbages, purple cauliflowers. There's orange cauliflowers. Have fun doing it. Tons of leafy greens if you can eat it. Depending on your digestive abilities, you can blend, you can steam, you can eat it in salads. So just enjoy these colorful plates. Have fun. If you have kids, have them choose the rainbow. Maybe they decide a new color that you're going to work on. The yellows, what does that look like? So really have fun with your family and build that colorful plate. Now, everyone wants to know where to start. Is there a specific diet? What do I do? And again, everyone is individualized with all of the plans we can do. There's some things that are kind of recommended to maybe take a look at. Restriction isn't the answer, but you can reduce inflammatory foods. So things like reducing highly processed foods and a lot of added sugars will be an important piece of this puzzle. Maybe some of the inflammatory oils. This is a good place to kind of start creating more awareness of where to start. I encourage people to read food labels and understand ingredients because there's a lot of marketing out there in the food industry. It's very deceptive. So if you're paleo, keto, I still encourage you to turn that package over and read the ingredients. And we're meeting you where you're at. So you can start with just adding in more vegetables. That's cool. But we do want you to be conscious of added sugars as well. Another area of goal you might want to consider is cooking more at home. Now, this is a challenge sometimes, but see, if you cook at home, you know the ingredients in your food, and you're taking the time to actually put energy into improving your quality of life by cooking at home. So options here would be like meal prep, batch cooking, find kitchen tools to help you out. I'm not a natural born cook, so I love a high-speed blender. So I do a lot of blending, smoothies, soups. You can actually hide a lot of ingredients, by the way, in soups and smoothies. So you can get creative. This is great for the family too. Find taste and palates, but you can still hide nutrition-dense food in those. Crock pots, instant pots, anything to save time. There's also tools that can use for people with arthritic tendencies as well. I encourage you to do that. And again, throw some music on if you're cooking, have some fun. You can sit down too and be able to prep your food as well. There's no wrong way to do it. You might have a stool, you can sit down, conserve energy. So these are all these topics to more create awareness, especially around nutrition. I do encourage people to create an inspiration board around food. What food do you like to eat? Now, again, if you're on the side that I am, like I love my pizza, but then I kind of dive in. Okay, pizza's on my inspiration board. Is there ways for me to make this a little bit healthier? Can I make my own pizza at home? What can I do and what inspires me? All these colors. How am I supposed to add colors? If you like Pinterest, a lot of people put together Pinterest boards. But just, you can take it from magazines. Maybe there's some ingredient or recipe that's inspired you. Put it together on a mood. It's like a mood board, but this will be your food board. So have fun with it. Talk to your family too. Some people have picky family members. So explore what they like to eat, put it together, and you'll start to brainstorm ideas, especially if you're visually inclined. It's super important to do. I could not leave this presentation without talking about digestion. As someone with a very crabby stomach, I do encourage people, if they're going to be changing their nutrition habits, to track your poop. It's not something that's commonly mentioned in symptom tracking, but I think it's an important piece to understand how food is also giving you inputs, because food, I feel, just tells your body what to do, and you can incorporate what's going on. You can learn a lot. So how many times a day are you having your bowel movements when you actually ingest food? What's happening? You're creating a lot of awareness around this. And I always encourage people to share this with their doctors, not just their GI doctors, but if you're tracking how this feels, because it can be really debilitating with digestion. And some people feel uncomfortable about talking about it because it's TMI, but I encourage people to talk about poop as much as possible. And with this tracking of like food, mood, and poop, you can also see what happens to your energy after you eat meals. So do you get sleepy? Do you experience headaches? Do you notice any joint or gut pain? Especially in different quadrants of the body. If you're eating meals and you're finding that you're getting a lot of stabbing pain, this is something to definitely talk to your doctor about. But that's why I want you to create more awareness around the food that you eat. Another thing that's important with digestion is mindful eating. Take time to eat and chew your food. If you're really in a hurry, there's a lot going on. Eating on the go isn't necessarily conducive for the best digestion. So, eat with your family. Take time away from the computer. Set yourself up. Maybe get some good dinner plates that you love. Get creative. Take time to do breath work before you eat your meal as well. So these are really top level. I know we're going to have more time for questions, Kelly, and as far as time goes, but I hope that was helpful in getting you started with some pillars of health. Ooh, I went backwards. So create joy. Thank you, everyone. And we'll be back.
Wow. Melissa, thank you so much. I learned so many things that I was like, why didn't I even think about that? Like the natural light in the morning, that's so fascinating. Having the first thing you see to wake your mind up as being natural light. And then the piece about melatonin, I know there's a couple questions about melatonin, so we'll get to it. But how you said that melatonin will not work. Your body will simply not produce it if you have a screen in front of your face or you're looking at a TV. I didn't even know that. That is huge. The other thing too, you talked about caffeine, and a lot of us don't realize that every person metabolizes caffeine differently. So one person maybe needs to not have caffeine past 12 or 2 or 4, or they will not be able to sleep because the body metabolizes it very slowly. Where other people may be able to have a tea at night, or um, maybe a cup of coffee after dinner, and they're just fine. Not the case with everyone. So you do have to be very cognizant. And even there's ways you can test that too. You can have your food testing done to see how you metabolize caffeine, which I found really helpful because I metabolize it extremely slowly, so I have to be careful about that.
I
So
know, I'm always impressed by people that can just drink coffee and go to sleep. So
no way, Jose. I will be up all night trying to solve the meaning of life.
and I know, Kelly, you put this challenge because these are a lot of pillars of health. I think we could do a video on each of these concepts. So I appreciate the top level. And I know I went through it fast, but we can answer questions too later.
Okay, well, let's get through some now, and then we're going to just, due to time, make sure that we have plenty of time for Tatiana next. So the question about melatonin, what are your thoughts on the use of melatonin supplements to help with sleep? Have you read any research on that?
There's difference of opinions. So I'm going to, since I'm not your medical provider, I can't tell you what to do. But again, here we've talked about creating endogenous melatonin as opposed to taking something as a supplement. So I encourage people to see if they can actually get your body to create more melatonin naturally before, and then talking to your doctor if you need to add more supplements to it.
Mm-hmm. That's a great response. Okay, you mentioned adding colorful vegetables and fruits into your diet. You mentioned eating the rainbow. Have you heard much or researched much about nightshade vegetables? Because for a long time, many autoimmune patients were told, absolutely not, don't eat nightshade. But then now there's more stuff saying that it's actually kind of case by case. What are your thoughts on the nightshade?
It is very individualized. I mean, more so with more rheumatic conditions and arthritic conditions, it can come up. So that's why we encourage more like journaling. So if you're noticing certain foods, and first of all, too, knowing what's a nightshade and those peppers and potato, like some of that stuff, and creating awareness around it, it gets complicated too when you're trying to track, because there might be other foods too that are adding to that. So like, again, I mentioned pizza, right? Do you not know if is it more of the pizza dough, the cheese, what's on the pizza, if I'm
Like
using peppers?
tomato? Yeah.
Yeah. So, I mean, this is where like some of the tracking, creating more awareness. And if tracking becomes stressful, then you might want to just take out some of the nightshade vegetables, and you can always reintroduce them and reintroduce the foods and see if you notice a difference at that point.
Great suggestion. Here's another one about melatonin. I'm also wondering about the use of melatonin. I heard you shouldn't use it, but I can't get to sleep without it. So Melissa already gave a great tip about that, trying to naturally induce melatonin. Let's see, any other, yeah, melatonin. I have trouble sleeping too.
Yeah, sleep is foundational, and we got to really work on sleep.
Okay. How do you feel? This is a nutrition question about using powder shakes to get your fruits and vegetables instead of consuming them either raw or cooked.
We always sort of look at whole foods first as opposed to the other ingredients. And again, it's going to depend across the board. You got to read the ingredients. You might even have sensitivities to some of those ingredients. Like I'm sensitive to soy, so I can't have any of that. And then I don't do well with legumes. So these pea proteins and all this stuff in there. And if you don't know or what these ingredients are saying, there's a lot of sneaky things in there. This is the challenge with finding this, but people like it because it's quick. So trying to figure this out and what works best for you, it's going to be individualized, but I always encourage people to read the ingredients, figure out if there's added sugars. Sometimes they go heavy on the fruits. So you're going to get a lot more impact of sugar than you really realize. So it's really hard even with juices to balance it out unless you're making your own. So keep that in mind, especially with sugars and understanding, because some of us too, fruit impacts us uniquely, and especially creating a lot of inflammatory responses for those of us with autoimmune conditions. Really understanding that impact, especially if you're taking in a lot of fruit.
That is so true. I don't eat very much fruit because of that. If I do, I'll have berries, and that's it. Because it does affect me for sure. Okay, we've got one here, and then I want to stop with the questions and hand it over to Tatiana. And then at the end, anything that we missed, we'll hopefully have time to go back and answer. So this last question for you, Melissa, is from Robin, joining us from Chicago. And she says, how do you feel about turmeric added to food or smoothies?
Well, because I'm not a dietitian, I'm going to have to always answer these questions like a politician. So how does turmeric affect you, Robin? And hello to Robin. She's a great supporter of all that we do. Do you notice that it makes a difference? I mean, some people find it good. There's difference of opinion. Some people don't like too much turmeric. Turmeric can actually be a stimulant for some people. So you might not want to take that towards the end of the day. But it's not necessarily the right or wrong. See how you feel. Again, going back to like maybe fresh turmeric root might even be different from a powdered turmeric root that you might buy at Costco. So it's going to vary depending on your usage there.
Great response to that. Well done. Diplomatic, but informative. Okay, so now I'm going to take off your, there we go, slide. And Tatiana, you can add yours on there. Thank you again to Melissa for your time and answering the questions. Okay.
Okay, so can everyone see my slide?
And there it is.
Okay, perfect.
Tatiana, we are so thrilled to have you with us today. Why don't you, if you don't mind, introduce yourself and tell everyone a little bit about your background, why you're stepping into patient advocacy, and so we can get to know you.
Thank you so much, Kelly, for this collaboration with More Than Lupus. So, like Kelly mentioned, I'm a patient engagement liaison with GlaxoSmithKline, or for short, we call it GSK. And I'm a master's prepared nurse. I worked in the hospital setting for 10 years. I have critical care experience, public health, and nursing education. And I recently transitioned to this side into the advocacy space. And I'm very, very passionate about educating patients, empowering them, getting them to understand concepts that are very simple. Sometimes I talk and people are like mind blown, and it can be a very simple concept that they maybe have heard, or maybe it takes a couple of people explaining it for them to capture it. And I am extremely passionate about people with lupus at the space that I work in. I've also taken care of people with lupus in the critical care setting. And I always felt like there was a lot more that we could have done before they got to us. So thank you for having me here. And I do believe in bringing education. I have resources for you guys and some tools to help you battle your symptoms of lupus.
I forgot I muted myself there. Wonderful, Tatiana. Thank you so much for sharing. We're going to hand it over to you for your slide presentation.
Thank you. So let me just post some things here. And I am very excited to be here at the beginning of the year, because I think that you can set a lot of intention and goals. And I know Melissa talked about goals. And I'm just going to kind of continue with some of the things that she brought up, because they are very, like you mentioned, pillars. They are pillars as you deal with a chronic condition. And hopefully today you learned some ways to manage your lupus in 2023. And I do have my own disclaimer. Remember, this is not a presentation that will replace you talking with your doctor. And I do recommend that you take notes in case that something I'm saying brings up a question, and you can write your question down, and then you can bring it up and discuss it with your doctor during your next visit. And as we know, lupus is different every day, and it can be very unpredictable. So at the end of my presentation, I have some QR codes that can give you access to some free resources and hopefully help you manage lupus in 2023. And let's start by highlighting the fact that you as a lupus warrior have a critical role when it comes to your own healthcare management. And people don't really see themselves as that. If you're living with lupus, you're familiar with a variety of symptoms, challenges that each day can bring. And also you're the only person that really knows what is happening to your own body, which is why being an engaged and an informed patient may lead to better health outcomes. And by actively and proactively managing those symptoms, you and your healthcare team can actually lower your risk of severe lupus flares and long-term organ damage. And someone that is proactive is what we call an engaged patient. But what does that really mean? An engaged patient is one who takes ownership of their health journey, and it includes having the knowledge, practicing the skills, and showing the willingness to proactively manage your health and care. And this is more of an overarching definition. So here we have 4 main areas in which you can practice being an engaged patient. And this can actually be helpful for absolutely any person, starting with education. Someone living with lupus has to take the time to learn and educate themselves about their diagnosis. And a good start is events like this one. So don't stop here. There are other resources that can help you continue in your management with lupus and prevent those complications. The second thing is monitoring and tracking your symptoms. And this is something that we hear a lot when it comes to lupus. So we'll talk about why this is so important. And I have some tips for you guys. The third thing is communicating with your healthcare team. And this includes sharing your own experience and participating in the conversations and the decision-making along with your doctors and your healthcare team, and even your caregiver or your support person. And I have some tips for you to prepare for those doctor's appointments. And the last area is taking ownership of your health. And one way that you can manage lupus is by sticking to a treatment plan. And this can be a lifestyle change or taking the medications as prescribed by your doctor. So maybe in 2023, you can work in one of these areas or maybe all 4 to become a more engaged patient. And as we know, there is no cure for lupus, but there are treatment options to help you manage those symptoms. And keep in mind that when you think about these options, you should always talk to your doctor about your treatment plan and find the best option that fits you and your lifestyle. And the symptoms of lupus will come and go during periods of flares. That's when you feel extremely bad and lupus is extremely active. And periods of remission where you feel great and you don't really have that many symptoms of lupus. And while there's no cure, lupus can be managed through different treatments, medications, lifestyle changes. And as Melissa mentioned, having a goal is extremely essential. And it can also help you stay on track and committed to a treatment plan. So I want you to think about your treatment plan goals for 2023 and what you want to accomplish. And here we have some examples, and it can be experiencing fewer signs and symptoms of lupus, proactively treating flares, preventing those flares, minimizing long-term organ damage, reducing inflammation, and minimizing drug side effects, for example, oral steroids. And these are all great for you to talk to your doctor about. And keep in mind that a treatment plan and your own goals may depend on your age, your own symptoms, your overall health, and your lifestyle. Because lupus is unique to every single person, so each treatment plan has to also be unique. And here we have the common treatments of lupus. And it's a good treatment plan. It's one that fits your lifestyle and one that you decide alongside your doctor. And this treatment plan may involve a combination of medications. So here we have the most common ones. We have anti-inflammatories, immunomodulators, immunosuppressants, antimalarials. And if you have been diagnosed or have been told that you have lupus nephritis, which is when lupus attacks your kidneys, you may also be on some diuretics, ACE inhibitors, or beta blockers to help support your kidneys. And we have many non-medical treatment options that your doctor may recommend you explore to help manage lupus, in addition to those traditional treatments and medications. And those we usually call alternative treatments. Melissa mentioned some of those, so you're going to see some of those on my slide. And those are massage therapy, counseling or talk therapy, pain management, stress management. It includes mindfulness, meditation, and also nutritional counseling. And if any of these sound very interesting to you, but you don't really know where to start, the best place to start is by asking your doctor for recommendations. There's also some lifestyle changes that may help you manage lupus in your daily life. And these are also some of the ones that Melissa mentioned, like getting enough sleep, getting the right nutrition, staying active, and practicing safe sun care. And once you find what works for you, it becomes your own lupus lifestyle. And you can talk to your doctor during your next visit and explore which of these alternative treatments may be worth trying in 2023 to help you achieve your treatment goals. Now let's get into symptom tracking. You will always hear us about symptom tracking when you are dealing with lupus, and this is because it's the main way that you can see how lupus is affecting your body. It can also give you a larger view of how lupus is affecting your daily life, and also like a clear picture of what your lupus journey is. And it can help you communicate with your healthcare team, because it's not always easy to put into words what you're feeling or what you're experiencing with lupus. And every single symptom matters when it comes to lupus, because it's a reflection of the disease activity in your body. And sometimes symptoms may not be easy to identify as a lupus symptom, which is why tracking is essential. Tracking involves monitoring your disease activity, communicating changes to your doctor, and being proactive in reducing long-term organ damage. And you can learn to identify when a flare is starting and maybe get help from your healthcare team to help you manage the lupus and take steps to prevent complications. A way to start is to start considering what symptom you're experiencing, how often it's occurring, how long it lasts, and how severe it feels. Also consider how your symptoms are impacting your life. A few examples of your day-to-day life can help your doctor gain a little bit of a better understanding of how lupus is affecting you and your lupus experience. For example, if you're struggling to get out of bed in the morning, which happens to a lot of people, or making you struggling to make it to every social event, or maybe you're not longer able to do something that you used to do. And one of the things that I hear the most is like going grocery shopping, coming home, putting all the groceries away and making dinner all in one go. A lot of people were used to doing that and not longer can do that. And that just shows your doctor the way that lupus is really changing your life. And the last thing that I want to mention here is to figure out a way to track this in a way that works for you. And that could be a calendar, a health journal, an app. I have a symptom tracking kit for you at the end. So whatever works and it's easy for you, just continue to do it. And one thing that Melissa mentioned was health journaling. And that is a way in which you can keep track of your symptoms and a lot more things like we can see here. A health journal is a complete and detailed record of your health experience. You can track your symptoms, your lifestyle changes, your nutrition, your emotions. It's very comprehensive. And with lupus, there can be a lot of health aspects. So this can help you stay organized. A health journal can help you take notes about your diagnosis, your medications, the dosages. It can also help you keep track of your lab results and your procedures. It can help you start identifying symptoms, triggers, emotions, and keep an eye on your mental health, which is very, very important. It can also help you identify patterns. And several studies have discovered that writing about your stress and your emotions, and which is also called expressive writing, has proven to have a clinical benefit for patients with autoimmune and inflammation conditions like lupus. Writing can be healing. Making entries into a journal can help you organize your own thoughts, reduce the stress, and manage the uncertainties of having lupus. Over time, your journal entries can give your doctor a more accurate picture of how lupus is really affecting you in a daily life. And maybe 2023 can be the year that you start health journaling. So I have some tips for you to get you started and some easy steps. First is to find a journal format that works for you. This could be written, or maybe you use your phone or your computer. Whatever works for you, just figure out what's easiest. and consider including drawing, photos, calendars, or anything else that helps you express what you're feeling. The second thing is to set up a journal with your health history and your goals for your health, especially as you're starting the new year. It can be refreshing to really think of what your goals are for the rest of the year. And then make a journal entry as part of your routine. Find a time each day or maybe each week. You can start by making 3 entries a week and then work from there. You can journal as often as you need to maintain an accurate record of your experience, or whenever you need to take a note. And your journal entries can include signs and symptoms of lupus. Some examples are joint swelling, fever, a rash, or anything else that you may experience. You can also track your blood pressure, your weight, and more. Like I said, it's very comprehensive. And you can add the emotional and mental symptoms that you're feeling, including your quality of life, any brain fog that you may be experiencing, or maybe put in what symptoms triggers and in which forms they're affecting you, so you can start taking steps and getting better control of your lupus. And communication is a very essential part of staying engaged with your healthcare team, and that makes sense, right? But when you have lupus, communication is not always easy. It's kind of hard to put into words what's happening to your body, what you may be feeling or experiencing. You may also have a bunch of doctors and specialists to update every week or every month or however often you're having changes. And you may also be dealing with brain fog. So I have some tips to prepare you for those appointments. So the next time that you see your doctor, it could be a few days, a few weeks, months. And if you haven't started tracking your symptoms, you can do it now and make sure that you've added the latest details of your experience. The second thing that I want you to start thinking about is how those symptoms are impacting your life. You can write down a few examples, like I'm having to miss out on family events, or I'm having a hard time staying active because of fatigue. And that can give your doctor a really good view of what it's like to have lupus for you. And the third thing to think about is what goals and expectations you have for that particular appointment. Do you want to live there with some solid ideas of what you be doing to manage your symptoms? Or maybe you want to change your treatment plan. You should also be bringing your list of concerns and questions so that way you don't forget them. And you can also bring an appointment buddy, which is just a close friend or a caregiver, support person that can help you remember if you are missing out on any questions that you had. They can also help you take notes during your appointment so you can keep track of your doctor's suggestions. And if your buddy can't make it to your appointment, you can call them before and after your appointment so they can help you to keep track of everything. And the last thing that I want to say, and this may be a little silly, is to practice what you're going to say during your appointment, because that just helps you make the most time with your doctor. There are also things that you can do during your appointment, like have your medication list and health journal with you. Be an active listener. That means that you are listening to understand, repeating takeaways, and taking notes. And if you're not understanding something, don't be afraid. You can ask for clarification. Sometimes doctors and nurses, we're very busy and we're just trying to get through the appointments and use very hard terms to understand. So you can just take a step back and ask, like, hey, can you clarify this for me? You can also ask your own questions to open up a conversation, like, what are my treatment options? Or if they're changing your medications, you can ask what side effects you should be aware of. And the last thing is, while you're with your doctor, you can also ask them about seeking a second opinion or referring you to a specialist. And this may seem like a sensitive question to ask your doctor, but most healthcare providers are comfortable giving recommendations. And the last thing that's not here, but I want to add, is asking your doctor what is the best way to communicate with them if you believe that you're having a flare, or if you have a concern that cannot wait for the next appointment. Appointments can be 3 months out. So what is the best way to get in touch with your healthcare team, and so you can get some communication and some feedback? And adherence. So this is a new term and something that you're going to be hearing a lot. And it just simply means sticking to a treatment plan as it was prescribed by your healthcare provider. And that includes taking your medications as prescribed. And that means the right dose, the right time, the right way. In addition, maybe you may have a lifestyle change, or maybe you have a nutrition plan, or that to help you achieve your goals. Are you able to stick to all of that? And as you work with your healthcare team provider to find the right treatment for you, be sure to understand what your options are, stay informed, because treatment adherence can help manage your lupus and prevent those flares. And when we're thinking about taking medications as prescribed or staying adherent, it's important to know that staying adherent can help improve treatment outcomes and reduce healthcare costs. So simply put, medications don't work if you don't take them. And in the same way, not being adherent can cause worsening of your condition, leading to increased risk of flares that may require hospitalizations, and that may lead to complications. And in return, it can cause higher cost and permanent organ damage. So as a starting point, always make sure that you understand what the dosing is, what the schedule is, the side effects of the medications that you're taking, and when you may start seeing improvements of your symptoms. Having the right expectations up front can help you continue your treatment in the long run, and also can help you identify if it's time for a change in your treatment. And as we know, people with lupus have many doctor appointments. They also have a lot of specialists. And this is what a typical lupus healthcare team may look. And this may not look exactly the same as yours, but I want you to think of your own team and how many doctors are prescribing medications for you. And it's very essential that everybody is on the same page and they're all informed of the treatment, of your treatment plan, your treatment goals, and if there's any changes to your medications. For example, if you have lupus and you're having symptoms on your skin, they're going to refer you to a dermatologist, and they may prescribe a new medication for you. So if you go and see your other doctors, like as you can see here, make sure that you tell them that you have a new medication and what the medication was for. And coordinating your healthcare team can be a lot. It can be a task on its own, but you can designate a caregiver or a support person, or maybe ask your primary care physician to help keep everyone updated and on the same page. And since we talked about adherence, we should also mention non-adherence. And it may happen more often than you realize. And as I share some of these examples, maybe think of last year and what your experience with lupus was. And you may identify that maybe you were non-adherent in 2022. And then I want you to start thinking of changes and ways that you can be more adherent in 2023. And some examples include skipping a dose, or maybe taking a smaller dose than prescribed, or extending the time between doses, or anytime you stop a medication without talking to your doctor, that's not adherence. And it could be due to side effects, it could be to symptom flares, or maybe not seeing results. So you may have an actual valid reason for not being non-adherent, but you should always talk to your doctor before making any changes to your medications, before stopping any medication, or if you're struggling and you're not seeing effects that you were told that you were going to see, or maybe you're seeing more lupus effects since you started the medication. So it's really important to keep your doctor informed. And with lupus, you may just simply forget to take your medication as they told you to take it. Each medication that you take, and you may have a bunch of medications to take, may have their own dose and may have their own schedule. So, and if you're experiencing brain fog, I advise that you identify a tool that will work for you to help you remember which medication, which dose at what time. So you can consider a calendar or maybe a reminder on your phone. You can use a timer, or maybe just ask the supportive person in your life to help you keep everything in check. And let's think back about the concept of being an engaged patient, as I mentioned at the beginning of my presentation, because a few of those things can help you stay on track for your treatment. And that can be understanding how the medications work. What is it doing inside of your body? You may not feel it working, but you know what the purpose of the medication is, and it can help you stay on that medication. Actively engage in your treatment plan by creating a routine, learning more about your condition, and staying motivated. And of course, staying in communication with your healthcare team. Are you noticing a new side effect? Since you now know how to communicate with your healthcare team, you can let them know. Or maybe you're feeling better because you're seeing that a few changes that you've implemented are working. Well, you can let your healthcare team know during your next visit. Also, staying organized in a way that works for you will help you take the medications when you're supposed to. And the last thing is to involve others in your care, like your caregiver, your friend, your family members. They all want to see you doing well. So they want to help in whichever way works for you. And as I promised, I have the QR codes, and I want to highlight two of these here, the two in the middle. One of them is a symptom tracking kit from us in Lupus, and all of these resources are free. And it has a symptom tracker, an impact tracker. It has a dictionary of frequently used medical terms, and it can really help you show your doctor how you're doing. It can be, a lot of people like it. I've heard really good things about it. And then the other thing is the other QR code in the center that talks about how to keep disease activity low so you can prevent flares and you can prevent complications. We also have resources at gskplayshub.com, and that includes some webinars. We have webinars in English and Spanish, and you'll see me and my other coworkers doing presentations like this one. So make sure that you come out and check us out. Thank you.
Thank you so much, Tatiana. That was action-packed. Oh my goodness. There was so much there. I loved so many of your examples were spot on. When you talked about how so many people have said getting through a grocery store shop, unloading your trunk, bringing the groceries in, putting the groceries away, and how defeating that is. It was like you were in my brain, because that literally happened to me yesterday. I'm like, I can't do this. This is exhausting. And that's one thing that can be a measurable gain or loss that you can tell your doctors about in your symptom tracker, in your lifestyle notebook, about things that are becoming more difficult because of your symptoms not being managed with medication or lifestyle, whatever it is. Really, really good point. Also, just want to remind everyone, if you have a phone, all you have to do, if you're not familiar with QR codes, is to take out your camera. You open up your camera and you just zoom it in on the QR code, and it will pick it up. It'll take you to the website. You just have to click on it. So that's how you do that if you're not familiar with it. I know it took me, when we first started doing these codes, a little while to get used to doing that, but that's how you do that. And there's so much great information there. They even have hard copy patient journals and symptom trackers. If you go to Us and Lupus, you can sign up to get one for free. Right, Tatiana?
Yeah, and that's a symptom tracking kit, and it has a lot more than just the symptoms. It's really helpful.
That is fantastic. Well, I'm going to leave those codes up here for a few more minutes. And there was a question for you that was pre-submitted at the top here. Okay, it was, how do you have, part of it got cut off here. How do you have a successful visit with your rheumatologist? Wait a second, I'm in the wrong section here. It's, one moment, please. The comments are getting all jumblified. Here it is. Okay. With having such short office visits these days, how do you have a successful rheumatology appointment, and how do you recommend prioritizing things to discuss with your doctors? I actually read a research study not too long ago that said patients often put their most difficult symptom as their third point to talk about. And so oftentimes they run out of time, and that one thing they really want to bring up, but they were nervous to do that, they wait till the end of the appointment, and then they run out of time, and then they don't address whatever it is. And sometimes maybe it's digestion, sometimes it's something more intimate, and they're afraid to talk about it, but it's a real issue. So how do you suggest prioritizing things to discuss with your doctors?
So I had tips to prepare for the appointment. So I would definitely prepare for the appointment, and I would recommend that you, whatever way you keep your symptoms tracking and the way that lupus is affecting your life, I would pull that up and I would just sit down and identify which is the one, maybe like Kelly has mentioned, your top 3 that you want to address. And like I mentioned during my presentation, setting a goal for that appointment. Do you want to walk out of there with new ways to treat your lupus, or maybe you want to change the treatment that you have? Whatever your goal is for that appointment, then prioritize that and make sure that you have your receipts, right? Like, these are my symptoms, these are my concerns, so that way you walk out of there feeling accomplished. And I do know that the one thing that really helps people do the most talking during their appointments with their doctors is practicing what they're going to say. How are you going to tell your doctor that you're not feeling well? How are you going to tell them that maybe the medications aren't working, or maybe you've tried a new thing and it didn't work and it gave you a flare? Like, so putting all of those things that you're experiencing into words, practicing them before your appointment, could really help you make the most out of your time, especially when, you may not have that much to talk, like not that much time to talk during an appointment.
I thought that was such a great tip, and we don't talk about doing that enough. And I think what can happen too is we can get really emotional in our appointments, particularly if there's something going on that's either new or traumatic, or maybe it's the first appointment and you've waited months and months and months and months, and you've gone to this doctor and that doctor. All of a sudden, they're giving you a lupus diagnosis, and you just are flooded with emotion, and it can be really hard to stay focused on the issues at hand that you need to discuss in the 15-20 minutes that you have. So I thought that was such a great tip to practice what you're going to say beforehand. Run through your bullet points, your talking points. I know it can feel a little whatever when you pull out your sheet and you're like, okay, point 1, and you work your way down. But this is so important that you don't leave there with regret, because we all know it might not be another 3-6 months till we get to see our rheumatologist in person again. The other thing I really like that you said, that we try and say here too, is making your moans measurable. Everything, doctors and medical professionals love measuring things. It's the way that they're taught, is to be able to measure either regression or growth or symptom development. So measuring things, and like Tatiana said, the grocery example, so good. Sleep, how many hours you're sleeping at night. I used to be sleeping 7 to 8. Now I'm only sleeping 4 to 6. Or in my best days, I get 5 hours. That's a measurable difference. I used to be able to walk to my car from the grocery store. Now I can't do that. I used to be able to hold my coffee cup. I can't do that now. Those are all measurable things. And that really helps your doctor to be able to see your progress or your regression of your disease activity. Let's see, what else? Oh, a lot of people comment on journaling. I think for both of these discussions today, that was a great takeaway. Journaling is good therapy. I need to journal this way. Yeah, I need to get a journal. Let's see. Edwina's saying that it can be frustrating with her doctors and trying to talk to everybody who's talking to each other. Robin kind of says the same thing here. It's very frustrating when all your doctors don't communicate. It can be hard for us to remember all that we have going on to reply to each and every visit. That's true. Very true. And not to mention, many of us either have a naturopath or a functional medicine doctor, as well as our PCP and everybody else that's in the mix too. It can be difficult. Any final tips on that, Tatiana?
I would say that you can recruit a loved one, a support person that can help you keep track of everything, and then can communicate it with those doctors. Mm-hmm. Or you can, like I mentioned in one of the slides, you can ask your primary care provider to take that role for you. Because having everybody on the same page of what your goals are, what you're struggling with, what your needs are, can help everybody kind of work together to get you there. And it's so essential. And especially when you have, you're not just talking about one or two doctors. People with lupus have all of those doctors that we saw on my slide. So it's essential that every single one of them knows what's going on with you. And it can be challenging, which is why you can ask for help. So a loved one or your primary, those are two good ones.
Absolutely. So we're about 7 minutes over right now, but this is such a great conversation. I'm just going to go for maybe 2 more questions and then let everybody go. Let's see what else we've got here. Okay. Let's see. Very informational panel here. Thank you. Very helpful. Wonderful. Yeah, the grocery shopping thing really hit with a lot of people too. Yep.
And I think it's because it happens slowly. So like the changes and the way that lupus affects you can be very slow. And all of a sudden you realize, oh yeah, I can't do these things anymore. Yes. I used to, and now I can't do them, which is why symptom tracking is so essential.
Yes. And writing it out too, not only is it good for the doctors, obviously, to see this, but it's also a release emotionally for us as we're going through it. I find it very therapeutic to write. I write a lot for More Than Lupus, and I know a lot of people are commenting that they write too, and it's very helpful. Because that's a very emotional thing. When one thing, as simple as it is, whether it's putting away groceries or opening a can or holding a coffee cup or getting up off the floor, showering, when you can't do that, it really affects you emotionally because you think you'll never be able to do it again. And so there's an emotional acceptance and mindfulness of where you are in the present when something like that happens. So I think there's a lot of benefits to journaling, emotionally and also for the benefit of your doctor to know what's going on. Let's see. A lot of people are just saying, great job, great information. It's been very helpful. Yeah. People mentioning sleep. Let's see. Yeah, just a lot of positive informations here. And some people who are struggling today, I just want to say, for those that are writing in that they're struggling today, we see you. We validate that experience. You are not alone. We are here to help you, just to be comfort, to know you have a space where you can talk openly about your ups and downs with this illness. And though the three of us are not doctors, we are here to provide resources and information that hopefully you can take back to your doctors and have open and honest conversations about what's going on right now with your disease, whether it's emotional or if it's physical. So on that note, I want to say thank you to our guests, and thank you so much to Melissa Talwar and Tatiana Speigler, and of course GSK for collaborating with us on this event. And for more information on upcoming More Than Lupus events, please check out morethanlupus.com. You can go to morethanlupus.com/events if you want to go straight to the events page. And we'll have updates and information there for you on support group meetings every month, webinars, educational events, resources, and more. And as always, you can check out supportfibro.org. Correct, Melissa?
Yep, that's it.
That's it. Great. And Us in Lupus with GSK if you Google Us in Lupus, it'll pop up, or you can use one of the QR codes that are still on your screen there. And that's it for us today. Thank you again for watching, and be gentle to yourself today. And hopefully, maybe if you took away 1 or 2 things from this informational broadcast, it is well worth it to us, and we hope it's worth it to you. So here's to 2023 and making good decisions about our own bodies in the future. Bye, guys, for now, and we'll see you soon.
Bye. Thank you, Kelly, for organizing this.
My pleasure.
Thank you, everyone.
Bye.
Bye.